Did you know that over half of people who use prescription-based hair loss medications make common mistakes? This also occurs with over-the-counter options as well. In this video, I'm going to share with you the do's and don'ts of the various options currently on the market for hair loss treatment, whether this is for male or female, doesn't really matter. The take-home points are the same. I hope you find some value here. If you have any questions, be sure to post those below the video and hit the like button. Cheers.
Okay, let's expand on the do's and don'ts for each hair loss treatment option. Again, I must emphasize that this is for informational purposes only and does not constitute medical advice. Consult a board-certified dermatologist or hair loss specialist for personalized guidance. Oral minoxidil do's. 1. Regular monitoring. Since oral minoxidil can have systemic effects, regular checkups with your doctor are essential. 1. This includes monitoring blood pressure, heart rate, and for any signs of fluid retention. 2. Start low, go slow. Dosage should be initiated at a low level and gradually increased as tolerated, under your doctor's supervision. 2. This helps minimize potential side effects. 3. Discuss all medications. Inform your doctor about all other medications and supplements you are taking, as drug interactions are possible. Don'ts. 1. Don't self-medicate. Never start or adjust the dosage of oral minoxidil without consulting your doctor. 1. The risks of side effects are significant, and professional guidance is crucial. 2. Don't ignore side effects. Report any side effects, such as chest pain, rapid heartbeat, swelling, or unexplained weight gain, to your doctor immediately. 3. Don't assume it's a quick fix. While some may see faster results with oral minoxidil compared to topical, it still requires consistent use and patience. 3. Don't expect immediate or dramatic hair regrowth. Topical minoxidil do's. 1. Apply to a clean, dry scalp. Ensure your scalp is clean and dry before applying topical minoxidil. 1. This helps with absorption and reduces the risk of irritation. 2. Be consistent. Apply the medication as directed by your doctor, usually once or twice daily. 2. Consistency is key for seeing results. 3. Massage gently. After applying, gently massage the solution into the scalp to help with absorption. Don'ts. 1. Don't over-apply. Using more than the recommended amount will not make it work faster or better and can increase the risk of side effects. 2. Don't apply to irritated skin. Avoid applying topical minoxidil to a scalp that is irritated, sunburned, or has open wounds. 3. Don't use heat after application. Avoid using a hairdryer or other heat styling tools immediately after applying topical minoxidil, as this can increase irritation. Oral finasteride do's. 1. Discuss potential side effects. Have an open conversation with your doctor about the potential sexual side effects and any concerns you may have. 2. Regular checkups. Schedule regular checkups with your doctor, including monitoring PSA levels as appropriate. 3. Be patient. It can take several months to see the full effects of finasteride. 3. Continue taking the medication as prescribed, even if you don't see immediate results. Don'ts. 1. Don't stop abruptly. If you decide to stop taking finasteride, discuss it with your doctor first. 2. Don't share medication. Finasteride is not suitable for everyone. 2. Never share your medication with anyone else. 3. Don't use if planning pregnancy. Partner. Finasteride is not indicated for women and should not be handled by women of childbearing potential, especially if pregnant or planning to become pregnant. 3. Men planning to father a child should discuss finasteride use with their doctor. Combination topical minoxidil finasteride, tretinoin do's. 1. Follow compounding instructions. If using a compounded formulation, follow the specific instructions provided by the pharmacy and your doctor. 2. Start slowly. Begin with less frequent applications to assess your scalp's tolerance to the combined ingredients. 3. Moisturize as needed. If dryness or irritation occurs, use a gentle, fragrance-free moisturizer as directed by your doctor. Don'ts. 1. Don't assume it's more effective. While this combination targets multiple pathways, it's not guaranteed to be more effective than individual treatments. 1. Results vary. 2. Don't use without doctor's guidance. This combination should only be used under the supervision of a dermatologist or hair loss specialist. 3. Don't use if pregnant or breastfeeding. This combination is generally not recommended for women who are pregnant or breastfeeding. Next, let's debunk some common misconceptions surrounding prescription hair loss treatments. Quick results. 1. Misconception. Hair loss treatments work quickly, and you'll see significant regrowth within weeks. 2. Reality. Hair growth is a slow process. 2. Most prescription hair loss treatments, whether topical or oral, take several months, typically 3 to 6 months or even longer, to show noticeable results. 2. Be patient and consistent with your treatment, as it takes time for the hair follicles to respond. 2 more is better fallacy. 1. Misconception. If a little bit of medication is good, then more must be better and will lead to faster, more dramatic results. 2. Reality. This is completely false and potentially harmful. 2. Using more than the prescribed dosage of any hair loss medication, topical or oral, will not accelerate hair growth. 2. Instead, it significantly increases the risk of side effects, such as scalp irritation with topical treatments or systemic side effects with oral medications. 2. Always follow your doctor's instructions precisely. 3. High doses always provide results. 1. Misconception. Higher doses of medication will always lead to better hair regrowth. 2. Reality. This is not true. 2. While some individuals may require a slightly higher dose, this should only be determined and monitored by a doctor. 2. Increasing the dose beyond what is recommended can increase the risk of side effects without necessarily improving results. 2. The optimal dose is the one that provides the best balance of efficacy and safety, and this varies from person to person. 4. Prescriptions work for everyone. 1. Misconception. If a medication is prescribed for hair loss, it's guaranteed to work for everyone. 2. Reality. Unfortunately, this is not the case. 2. Hair loss has many different causes, and not all treatments work for all types of hair loss. 2. Even for conditions like androgenetic alopecia, male and female pattern hair loss, individuals respond differently to medications like finasteride and minoxidil. 2. What works for one person may not work for another. 2. Furthermore, some people may be non-responders to certain treatments. 5. Use in inflammatory hair loss. 1. Misconception. Prescription hair loss medications can effectively treat all types of hair loss, including those caused by inflammation. 2. Reality. While minoxidil might have some limited benefit in certain inflammatory conditions, finasteride and other similar medications are primarily designed for androgenetic alopecia. 2. Inflammatory hair loss conditions, like alopecia areata, lichen planopilaris, or lupus erythematosus, often require different treatments, such as corticosteroids or other immunomodulatory therapies, to address the underlying inflammation. 2. Using the wrong treatment can be ineffective and potentially worsen the condition. 6. Use in psoriasis. 1. Misconception. Hair loss medications can be used to treat hair loss caused by psoriasis. 2. Reality. Psoriasis is a skin condition that can sometimes affect the scalp and lead to hair loss. 2. However, the hair loss associated with psoriasis is usually due to the inflammation caused by the psoriasis itself. 2. Treating the psoriasis with appropriate therapies, topical corticosteroids, calcineurin inhibitors, or systemic treatments, is usually the best approach to address both the skin condition and the associated hair loss. 2. Standard hair loss medications may not be effective for psoriasis-related hair loss. 7. Off-label uses. 1. Misconception. If a medication works for one type of hair loss, it can be used off-label for any other type. 2. Reality. While doctors sometimes prescribe medications off-label, this should only be done by a qualified physician after careful consideration of the risks and benefits. 2. Off-label use doesn't mean the medication is guaranteed to work for the other condition, and it's essential to have professional guidance. 8. Stopping treatment. 1. Misconception. Once hair regrowth is achieved, you can stop the medication and the results will be permanent. 2. Reality. For many hair loss treatments, especially those for androgenetic alopecia, Continued use is necessary to maintain results. 2. Stopping the medication often leads to a gradual reversal of the hair growth achieved. 2. Discuss with your doctor before discontinuing any hair loss treatment. It's crucial to have realistic expectations and to understand that hair loss treatment is a journey. Consult with a board-certified dermatologist or hair loss specialist to get an accurate diagnosis, discuss treatment options, and create a personalized plan that is right for you. Don't rely on anecdotal evidence or misinformation. Professional guidance is key to achieving the best possible outcomes. Finally, let's learn about possible adjunctive hair loss treatments. These are therapies that can be used in addition to standard treatments like minoxidil and finasteride to potentially enhance results. Consult a doctor before beginning any treatment. 1. Low-level light therapy, LLLT, or laser treatment. 1. Mechanism. LLLT uses red or near-infrared light to stimulate hair follicles. 1. It's thought to increase blood flow, reduce inflammation, and promote hair growth. 2. Benefits. Non-invasive, generally safe, and FDA cleared for hair loss. 2. Can be used at home with devices like laser combs or caps. 3. Drawbacks. Results can be variable, and it may not be as effective as other treatments. 3. Requires consistent and long-term use. 4. Considerations. Look for FDA-cleared devices and follow the manufacturer's instructions carefully. 2. Dermaroller, microneedling. 1. Mechanism. A dermaroller is a small roller with tiny needles that create micro-injuries in the scalp. 1. This is believed to stimulate collagen production and release growth factors, which can promote hair growth. 2. Benefits. Relatively inexpensive and can be done at home. 2. May enhance the absorption of topical medications. 3. Drawbacks. Can be uncomfortable or painful, and there's a risk of infection if not done properly. 3. Results are variable and more research is needed. 4. Considerations. Choose a dermaroller with appropriate needle length for the scalp and follow proper sterilization techniques. 3. Scalp injections. 1. A. Corticosteroids. Mechanism. Corticosteroids are anti-inflammatory medications that can be injected into the scalp to treat certain types of hair loss caused by inflammation, such as alopecia areata. Benefits. Can be effective for localized hair loss due to inflammation. And drawbacks. Can cause pain at the injection site and may have systemic side effects with repeated use. 2. B. Platelet-rich plasma, PRP. Mechanism. PRP involves drawing a small amount of blood, processing it to concentrate the platelets, which contain growth factors, and then injecting it into the scalp. Benefits. May stimulate hair growth by delivering growth factors to the hair follicles. Drawbacks. Requires multiple treatments and results can be variable. More research is needed to confirm its effectiveness. 3. C. Stem cells. Mechanism. Stem cell therapy for hair loss involves injecting stem cells, often derived from the patient's own body, into the scalp. The idea is that these stem cells can promote hair growth. Benefits. Holds promise for hair regeneration, but it's still a relatively new and evolving field. Drawbacks. More research is needed to determine its safety and effectiveness. It can be expensive and is not widely available. 4. Current alternative treatments on the market. 1. Topical formulations. There are various topical products marketed for hair loss that contain ingredients like minoxidil, still a popular option, and finasteride. Topical versions are available, but systemic absorption is possible. Tretinoin may enhance the penetration of other topicals. Ketoconazole, an antifungal that may have some benefit for hair loss. Caffeine. Some studies suggest it may stimulate hair growth. Essential oils. Some may have potential benefits, but more research is needed. 2. Oral supplements. Many supplements are marketed for hair loss, containing vitamins, minerals, and other nutrients. 2. While good nutrition is important for hair health, there's limited evidence that supplements can significantly impact hair loss in most cases. 3. Other options. Microneedling with topical solutions. Combining microneedling with topical medications or growth factors may enhance their effectiveness. Exosomes. These are tiny vesicles released by cells that contain growth factors and other molecules. Topical or injected exosomes are being explored for hair loss treatment. Important considerations. 1. Consult a dermatologist. It's essential to consult with a board-certified dermatologist or hair loss specialist before trying any adjunctive hair loss treatment. 1. They can assess your specific condition, discuss the potential benefits and risks, and help you determine the most appropriate treatment plan. 2. Evidence-based approach. Look for treatments that have scientific evidence to support their use for hair loss. 2. Be wary of products with exaggerated claims or limited research. 3. Realistic expectations. Hair loss treatment often requires patience and consistency. 3. Don't expect miracle cures or overnight results. 4. Combination therapy. Often, the best approach involves a combination of treatments, such as minoxidil, finasteride, and an adjunctive therapy like LLLT or PRP. Remember, this information is for general knowledge and does not constitute medical advice. Always consult with a qualified healthcare professional for personalized guidance on hair loss treatment.